Hello, everyone. Thank you for joining today's virtual meetup. On today's agenda, we'll be discussing the new coronavirus vaccine distribution solutions. We're recording this meetup and we're reposting this recording to YouTube. I will share I've already shared the YouTube playlist that we post all of our recordings to, so you can go and check that out. Later in the meetup, we'll have a couple sections for questions and answers. So if you'd like to submit questions, there's a Q&A panel at the bottom, the button that will open up a Q&A panel at the bottom of your Zoom window. You can go ahead and ask us questions there and we'll get to them during those sections. So with that said, I'll go ahead and pass it over to Scott and get us started.
Okay, thanks, Matt, and thank you all for joining us today. My name is Scott Ottman, and I lead our ArcGIS Solutions group. And joining me today are two members of the team, Jeremiah and Mike, and we're going to talk about the new coronavirus vaccine distribution solutions. For those that aren't familiar with ArcGIS Solutions, we really sit at the intersection of business and technology and provide ArcGIS users industry-specific maps and apps that help you leverage the investment you're making in ArcGIS and location-based data. These extensive capabilities are developed with the community and come with ArcGIS, much like other capabilities you use in the software we deliver. And they're fully supported. So if at any point in time during your implementation, you need assistance configuring the solutions we provided or just implementing them in your organization, just know that there's a whole host of resources available to help you do that. Today, as I mentioned, we're going to talk specifically about the vaccine distribution solutions. And in December, when we started looking at how we might be able to help state and local health agencies with their pending vaccine distribution plans, we saw some common patterns or needs emerge. The first thing that we heard was that there's a great need to help increase overall public confidence with the vaccines and the process they went through to be approved and ultimately start to be distributed. Each state was developing and has developed their own vaccination plans in concert with the overall CDC guidelines, and how you communicate those plans and ultimately who's eligible is quite important. And we've seen that even recently here domestically. We wanted to help people that were eligible for a vaccine know when and where they can be vaccinated. And the other aspect that we were thinking about is how do we help communities start to build a volunteer workforce to assist with mass administration of vaccines when we do get further along in the distribution of this vaccine. So really kind of increasing public confidence and trust and communicating vaccination plans was a key aspect of the early work we've done. Another thing that we saw was the real need to build confidence in the execution of those plans and being able to monitor, much like communities have been doing with cases and testing already during the pandemic, but monitoring the actual distribution programs you're executing, track providers you've enrolled, doses that are available through the CDC and the state, and ultimately how many you're administering and the coverage, both demographically that makes up and also along racial and other equity lenses. So today we're going to show you two solutions. The first is vaccine outreach. It's really designed to be that public engagement offering that helps you communicate vaccination plans and eligibility. It comes with a series of information products that help that are really designed to help health and human services staff manage your outreach activities. And then the primary focus of this solution is really how do you really market those vaccination plans and build public confidence in the vaccines to the general public. And so when Jeremiah shows you this in a few minutes, you're going to see that it really is designed for the public, and many of the information products in this solution really are focused in that outbound communication. The other thing that I'll mention with vaccine outreach is it's a very simple solution to get started with, because it really only requires a little bit of data to get you going, and that really is an inventory of our vaccine providers that are enrolled in your community. The second solution Mike's going to show you today is the vaccine distribution dashboard, and this is designed to help you monitor those vaccination plans and really gauge the progress you're making. This is a much simpler solution, much like the recovery dashboard we've developed previously, that has that vaccine distribution dashboard designed for both a mobile and desktop environment, and we'll talk more about that later today. So a simple way to share the metrics that are important to your community. And then we know that this information will be coming from a variety of sources. So you can load that dose information from existing systems that you may be managing, or we have a simple survey and configuration of dashboard to help you just enter that information that may be coming from different sources in your organization. So we really want to spend the bulk of our time with that context in mind, showing you the solution. So I'm going to turn it over to Jeremiah first, and he's going to start with the outreach solution offering, and then Mike will handle the distribution dashboard. So Jeremiah, I'm going to stop sharing. You can take it from here.
Perfect. Thanks, Scott. Just a quick check. Can you see my screen okay?
We can.
Okay, great. So let's just dive right in and take a look at what you get when you deploy the solution. A key aspect of any campaign, such as promoting vaccination, is a web destination that helps the public access important information. So what we're looking at now is an ArcGIS hub site that comes with the solution. I want to take a few moments just to kind of go through this at a really high level before we dive into the specific information products. What we do is upfront display what phase we're in. Most states are taking this approach of having phases, and you can really highlight where you are within the rollout of vaccines in your community. Links to safety. Again, this is a big concern. So official guidance from the CDC about safety that's out there. Scott mentioned we have two solutions, one of them being a dashboard that shows us how we are actually doing over time. I'm going to just gloss over this, and we're going to come back to this, and Mike will explain this in more detail about how do we populate it and how to interact with the dashboard. Again, just really kind of high level messaging. As you've probably heard, hygiene, wearing a mask, social distancing, this is not going to go away when people get a vaccine. So we're really helping you communicate the importance of what we need to do to really come out of this. Then we scroll down and we get into some really additional information products that are included with the solution. I'll come back to them, but I'm just going to go in order of sequence of the messaging that the hub site relays. One of the things that our health team heard as they were engaging with health departments the last several months was this concept of building trust. And this has been a really big recurring issue. There's vaccine hesitancy amongst many people. And in order for us to really come out of the pandemic, we need to get about 70% of the population vaccinated. So this is going to be a really community effort. We'll show you how we can approach that. I live in Colorado, and it seems like a real hot topic over the last week is confusion about, am I eligible to get a vaccine or not? It's really kind of hard to determine. So we have a tool that will help people really look up and see, are they eligible? If you are eligible, then the next question is, well, where do I go and how do I do this? So we have a locator map to find vaccines within our community. We want to collect experiences, good or bad, whether people are getting vaccinated or not, and how we can follow up with them. We have a frequently asked questions section that you can populate. We've seen a few examples of people using the solution already, populating this. And as Scott mentioned, ability to volunteer for help. And you might want to show key events, such as maybe you're going to hold some mass vaccine clinics in your community. So that's an overview of the whole hub site and destination. But let's go back and dive into a couple of these things in specific. So the very first app that I spoke to around building trust was this I Got Vaccinated app. And if I click to learn more, what this will do is it will launch the I Got Vaccinated application. And what this is it's a very simple map. It just locations on the map with stories. So people can, in your community, after they got vaccinated, they can share their experiences. And really all this is to build trust and help share those stories. I think especially right now, the people getting vaccinated are frontline healthcare workers, and they've seen a lot more than most of us. So their stories are very important as we can start to scroll through this. You're getting around that idea of vaccine hesitancy. If someone's kind of on the edge, whether or not they're going to get a vaccine, they might be more inclined by looking at these stories. And above all, I think this is just a time for excitement. We're turning the corner and hopefully going to be having different lifestyles soon, and people can share their stories. We're seeing some communities start to localize this, have their own campaigns. Our friends at GIS Core is starting to have a national map, but we really see this as being a way that communities can take this on and build that community within themselves. Next step is, am I eligible? You know, if you decide, yes, I want to get a vaccine, I can click this learn more. And what this is this is a configuration of survey 123, where I can go through and answer questions. Am I a healthcare worker? If so, yes, I can go get a vaccine, and I can look up my locator to see where I can. Myself, I'm not a healthcare worker. I'm not an essential worker. I'm not over 65. But what I might want to do is provide some other information. So give the information back to your city or county and my email. So maybe I want, you know, this is a way that you can engage with your constituents. Make sure that they're following up. You know, there is a worry that, you know, maybe the cases are going to be going down and things are looking good, but we're not getting totally vaccinated. So if these people are interested now, make sure they're still interested and following up later on. If I scroll down a bit more, the next step was, let's get vaccinated. And where do I go? The survey links to that, but this is another link to the vaccine locator. When I click on this, this is a much more map-focused view for my vaccine locator. This is a configuration of the nearby app. It's mobile friendly, so it gets a little bit different view on a mobile device. But what I can do is I can type in an address or just click on the map. I'm using a radius here, and I can see all of the locations where I can go and get a vaccine. Now, this is just really a way for you to relay what is out there. Your constituents will want to contact these locations. They might want to go to their website, which we have a button here as well to maybe schedule an appointment. We have directions here. One thing that you can see is some of these locations also have a wait time in the banner. And this is some feedback we got from testing sites and just looking a little bit ahead in the future. If we're going to be doing some mass vaccinations, how long are we going to be waiting at specific sites for this? So that's a vaccine locator. Very simple lookup app about where do I go next, and people can start calling or looking at websites to see where they can go to get vaccinated. Okay, after people get vaccinated, what's next? Collect their experiences. So we can really see and track the progress of how folks are what the public sentiment is. We can capture whether or not people got vaccinated. If no, we might want to capture the reasons why. Is it vaccine trust? Do we not have enough locations set up? So this might help us tell us a little bit more about what we need to do to get the vaccines out. If I did choose yes, just collecting some metrics about how easy was the process and any comments. We're capturing a little bit on demographics, age, and ethnicity. And then that I got vaccinated map that we saw earlier. Optionally, we can come in here and say, yes, we want to share stories. That's where they upload their selfie and their story, and all that information will be populated in that I got vaccinated map. Now, it doesn't appear there right away. There is an approval process, which I'll show you in just a moment. Coming back to the hub, really the last public-facing thing I want to show you is another survey 123 to volunteer to help. So volunteering to help, this is really, again, going to be a community effort, and we may rely on volunteers. So there's a survey form to collect information about our volunteers. We're capturing where they are because we might have a pop-up clinic and we want to match the closest people to that. Availability, kind of standard volunteering questions. And then, if we've been vaccinated or not, and then what types of help are they going to be doing? One of the types of helps might be, actually administering shots, and not just everyone can do that. You have to have the appropriate credentials to do so. So we're collecting some information too to really help you as you're interacting with these volunteers to know how they can help you with your efforts in getting the vaccine out. So quite a few information products along with the whole hub. So when you deploy the solution, all those are wired together. So you get the hub, but then you get all of these links to the applications and the surveys that I just showed you. I'm going to switch gears just a little bit now and talk about internal. So everything that I've shown you so far are meant to be public facing and how your citizens can interact and you can promote your vaccination efforts. Now I'm looking at an internal application that really helps you manage some of this data. I'm looking at an application called the Vaccine Outreach Manager. This might be an analyst or an epidemiologist that really wants to kind of update the information as it comes in. There's 3 different data sets that you might want to update. One is those I got vaccinated stories. As I mentioned, you might want to vet them just to make sure that the stories are good before they show up on the map. So you can look at the submissions. They come in by default as submitted. But what I can do is I can come through, do a quick look at the media and their story. If I'm good with it, I'll just change their status to approved. When that's approved, their story will then automatically appear on that I got vaccinated map. You can also set up things like webhooks to get email notifications as these contributions are coming in as well. The next data set we want to talk about is volunteers and how we can manage those. So really this can be your console to help look at the volunteers that have enlisted. So I see a listing of volunteers. I can look at them spatially to maybe pair up where there might be a pop-up clinic or anything that I want to interact with. Just a quick way, maybe I want to do a quick contact with those volunteers or send an email, which will launch an email to that person. So that's how I can start that dialogue. And the last thing I want to talk about updating is the locations. So if you remember my, where do I get vaccinated, my lookup map, that information, as we've already seen, is changing a lot. It's changing very rapidly. There's more and more providers that are popping up. So this is a way that you can start to manage those locations. So for instance, if I have a pop-up clinic that I've added, I might want to change the information on that. One thing we've seen already are the operational hours are changing, even for things like the pharmacies. So it's a way for me to come in and quickly change operational hours, the comments, all of this information then will automatically be reflected on that public facing map. So it's a way for you to easily manage the data from this standpoint. Now, one of the things that you also saw is in that public facing map with the locator, some of these locations had the wait time. If you wanted to share the wait time with folks, you're probably going to be having people that work those locations. So they might be volunteers or maybe staff from your county health department. If you click the share wait time app, that will send an email, and the email will have a link to an application that looks like this. And this is really meant to be run on a mobile device or tablet for that person working the location. And what they'll do is just one job to basically come in and update the wait time. And they might do this every 15 minutes or so to update the wait time. And that's all that has to be done to really update that. And again, that's going to automatically reflect in the public facing application too. We've seen a lot of success in this pattern with elections and looking at wait times for polling locations. So that was a tool that I can help manage my data and update the data that goes along with these applications. I just want to end with about how do we get this. If you've not seen the ArcGIS solutions before, and the app switcher, we introduced the ArcGIS solutions task last year. If I open this ArcGIS solutions app, I can see all of the 90 applications. We're going to have more in a release next month. I'm looking at the vaccine outreach. Mike will talk about the distribution dashboard next. Go ahead and click on this and then click Get Now. When I click Get Now, what it's going to do is it's going to deploy everything to my organization. The hub sites, all of the surveys, all of the applications. It's going to deploy hosted views for security. So we've thought about all that as we put them together. And wire everything all up for you. So it's really a one-click deployment and you get everything ready to go. Do want to quickly point out too, a recent addition is if you've been using ArcGIS Hub, the solutions now appear as initiative templates, and the same story happens there. So the same solution that we're looking at, if you choose the vaccine distribution outreach solution, everything that is going to deploy the same manner, just as you would from solutions. And lastly, I do want to just talk about documentation, because we've had a really nice change a couple months ago to the way that we present our solutions in our documentation. If I click Get More, our solutions have a few pages on them. What it will do is it will take me to an introduction or overview. And this will give me a little bit more in depth before I deploy a solution to see, what are the requirements, what are the specific information products, and I can kind of get insight as to, is this really meant for me or not? Then I get a nice tutorial. The use section will take me through how to use the solution. And in many cases, we have try it live links. Everything that I showed you today, you can run through this and you can try it out on your own with the sample data. So it's a great way to see that. And then lastly, configuring. So anything additional you want to do. The nice thing about these solutions is that they are all configurable, they are all extendable. We give you a nice base solution, but people might want to take it a step further. A couple examples are modifying surveys, adding questions to the surveys that we give. Maybe you want to capture more information from the general public. Changing the provider app, where I might want to look at where can I get vaccinated. Maybe I don't want everything to be symbolized in my locator by a single dot. We have instructions on how I can symbolize that by the wait times in the documentation too. So take a look. There's a lot of great information in the documentation as well for how to deploy the solution, run through and use every element of it, as well as what I might need to do for common patterns to extend it. So that was a lot. Again, there's the hub page and several information products that really kind of spawn off that, really to help you with promoting vaccinations in your community. So we're going to turn it over to Mike, and he's going to talk about the distribution dashboard. But before we do that, we'll just kind of pause and see if anyone has any questions at that point.
Hey, Jeremiah, while Matt's kind of pulling any questions we have, you hit on this a few times, but maybe just talk about the work you did to kind of make sure the info products work well on any device and our focus there.
Yeah, so as far as working well on any device, we didn't have to do much when we built the solution. So the nice thing is we're building upon standard applications that come with ArcGIS. So in this case, it's Hub or it's the Nearby app. So all of these applications here that I might use, if I'm going to be viewing in a mobile mode, it's going to change on the fly for me. So it's going to have a responsiveness that will take on the mobile characteristics for me. So all these applications run in the browser, but will recognize the device you're on to take on the mobile appearance.
Yeah, I think that's the important thing, right? Is that you selected the right app so they would work in both environments.
Yep.
And then you passed on the dashboard, and I don't want you to kind of go into that, Michael, going out in a minute, but maybe just talk about the integration of the two, kind of what you get if you deploy it. You won't see the dashboard in there, right? And how did you guys kind of work together to integrate it?
Oh, correct. Yeah, so there are two solutions. If I scroll down and I look at what I was showing earlier, is I have links to the applications and the surveys. All of that's really wired together. In the past, that was kind of a challenge, but what it does now is I deploy the hub and everything gets integrated together. The one thing that you will not see is the dashboard. We have a placeholder for it, and if you deploy the solution Michael to talk about, you can then embed that dashboard. That is, speaking of the configuring sections that I went over, that is one of the areas where you can extend that basic guide through and see how to do that. But you can add your own elements to this and also add the dashboard from the additional solution Mike will talk about.
And I guess, Matt, I don't know if we have other questions going in, but the other thing we've heard, obviously, Jared, that people can configure that eligibility survey to match the phases and the eligibility they have locally, correct? Just the standard survey that we provided a starting point.
Exactly. So this is we know this is going to change over time. So correct that right now I'm not 65 and I don't fall in that category, but eventually you're going to want to change this to make sure that when you're in that phase, you can update the survey. So everything can be configured as needed. Another example is, Colorado, we're using 70 as a guideline. So yeah, everything can be configurable, but it's a great place where you can come in and just make your small changes to share that information, what you want to the public.
We did have one question just come in. So is there a component to track vaccine availability? So it seems like that's kind of a getting an appointment is the main hurdle around the location of that person.
So vaccine availability at the specific locations, we don't really have it at that point as far as doing an inventory. I think there's challenges, especially with places like pharmacies that are getting that now, and a location like a state or county health department that might run this is not going to be in sync with all that. So I think the general recommendation is to follow that. You can relay whether or not someone is eligible. You can relay where people can have the ability, and then really it's going to be on the citizens to kind of make that next step and see make the appointments on their own.
And I think that's kind of we had a follow-up or an additional question that I think is related to what you just mentioned. So is there any kind of integration with scheduling for vaccine time slots for providers?
I think what we've seen so far is people making their own locators. And again, this is another place where you can extend this. And oftentimes that's just going to be a link on this website that you might put up. So you would link into, the county health department is not going to be in charge of scheduling what a hospital does or what a pharmacy does, but you can help your constituents get to where they need to go to make their appointments.
Yeah, and I think, Jared, that's kind of what right there is you could integrate it right in the locator as part of the eligibility survey when they finish that, and even just generally on the hub site, you could add integration to the scheduling system you're using, and make sure people see very clearly how to do that.
And then someone was asking kind of in terms of how widely is this distributed in terms of information, how we share ArcGIS solutions to, local governments, state governments. And I think that the answer to that would be, we definitely share through what we do as a team and our meetups and our recordings, and we push out from a product information. And then in terms of our staff that works directly with those state and local governments, they're communicating with those health departments and other providers directly as well. So I would say it's relatively well, widely known, and just through our normal kind of communication with state and local governments, if that makes sense.
And even through social media channels and other places. You're right, Matt. Yep, for sure. Okay, you want to switch over, Mike? You want to keep going?
Sure. Yeah, I'll stop sharing. It's all you, Mike.
All right. Thanks very much, Jeremiah. You guys let me know when you can see my screen.
Got it.
All right, thanks. So you briefly saw the vaccine distribution dashboard embedded on the vaccine distribution hub site that Jeremiah showed you. So we're going to take a closer look at the dashboard, the information it helps public health agencies monitor, and as we saw on the site, share with the public, how the vaccine distribution data can be loaded into the solution, and a few configuration tips. So the dashboard is configured to display important distribution metrics quickly while also providing key demographic categories for further investigation. So we can quickly view high-level counts of points of distribution, that is the number of locations where the vaccine is being administered, the number of doses administered, as well as the total number of doses obtained. In this case, 6.5 million doses have been administered, that's needles and arms, to the public, and 7.2 million have been obtained for a particular area. As doses continue to be administered, it's important to understand the current coverage rate. And because most of the coronavirus vaccines require 2 doses, we want to understand coverage in terms of both partial and full series. So here we can see that roughly 4% of the total population has received only the first dose in the series, while 23% have been fully vaccinated. By showing these coverage rates over time, the vaccine coverage by total population chart provides additional insight into this relationship between partial and full series coverage. Our data here projects into the future a bit, and we can see the partial series coverage rate dropping as more people receive full series coverage, with the goal that eventually everyone transitions from partial series coverage, that first shot, into full series coverage, and this would eventually be at 0. Each of these charts on the dashboard, as well as every element, can be expanded so that it can be inspected in more detail, and the legends on the charts can be toggled off and on to look at something in particular more detail. Vaccine distribution is initially targeting priority and vulnerable populations, so it's important to understand these coverage rates for several demographic categories. So the stacked charts here on the bottom help us do just that. What they do is they provide breakdowns of full series coverage across several different categories, such as the priority populations that are being prioritized, for example, in the 1A phase, as well as breakdowns for age, race and ethnicity, and gender. And again, each of these categories, or each of these charts, can be interacted with by toggling a particular category on and off, or expanding to look at it in more detail. The dashboard's capable of sharing metrics for multiple geographies. Thus far, we've been looking at metrics at the state level, but we can view information for additional geographies in a few different ways. First, I can interact with the map by clicking on a particular area. In this case, the map is showing health regions for the state of Illinois. And here I can see the full series coverage metrics for each of these regions. I can also use the selector here at the top to select the area that I'm interested in. So again, we've been viewing the entire state, but I can select a particular health region, and that's going to update the entire dashboard, all of the metrics, all of the charts to show relevant information for just that area. Terms like partial and full series coverage may be unfamiliar to the general public, so to help users understand the data, we've included a Learn More section that defines the terms that we're using on the dashboard, and this can be customized to display useful information your organization would want to share with the public or even internal stakeholders. It also displays when the data was last updated. So Jeremiah showed you the vaccine distribution hub site with the dashboard embedded, and he also talked about the responsiveness of these applications for mobile devices. Because we know many, maybe even most users will access this important information on a mobile device, we wanted to make the dashboard flexible for the different types of devices that'll access it. So we included a mobile dashboard that has all of the same information and all of the same metrics. Just for ease of demonstration, I've loaded it here, but it is a responsive dashboard that knows the type of device that's accessing it. So if it's accessed by a mobile device, this is the dashboard that you would see. And again, it has all of the same capabilities. So at this point, a good question you may be asking is, how can your data be loaded into the dashboard? And for that, we've got a few options. First, the vaccine distribution reporter can be used by public health staff to tabulate current metrics at a regular interval. After selecting my reporting area and the appropriate date, I can begin to populate the current metrics for each of the categories that we saw in the dashboard. One thing to note is, as you update the coverage rates, the population total for that particular category, so in this case, it would be the total population. So we see that being consistent here, so the total population. And as I modify this number, the form is going to calculate the coverage rate for me. It's this coverage rate that ultimately gets submitted into the data and is displayed on the charts that we just saw, the charts that displayed coverage rates over time. So I can populate each of these categories for a particular reporting area at a particular interval. This might be updated, say every week or every day, especially in the beginning of vaccine distribution. Submit, and then that's going to immediately hydrate the dashboard with updated content. Depending on how vaccine distribution information is compiled in your organization, it might be advantageous to upload the information en masse. So the solution includes a CSV file here that I've populated with quite a bit of data that can be uploaded to the appropriate feature layer. So in this case, I've got a record per reporting area. So at the overall level, we've got the state of Illinois and those health regions that I mentioned, and then per date. So each record is per date, per reporting area with all of the appropriate metrics. That can be uploaded to the vaccine distribution feature layer using the online append tool. And this is detailed in our help documentation as well. And finally, I want to highlight a few help topics in our documentation to give you a sense for how the dashboard can be configured and extended. You saw the, or actually I failed to mention the herd immunity distribution goals here reflected on each of the charts. So as I look at the partial and full series chart, as well as these demographic breakdowns, I can quickly visualize the current metric and how that relates to our overall goal. A standard herd immunity number is 67%. But I might want to configure this number for my community's goals. And if I wanted to do that, I could follow these step-by-step instructions. But it's as simple as here I'm viewing the dashboard in an edit mode. It's as simple as configuring the charts series guide, changing the percentage, say to 70%, and the label, and that's it. We've also included a number of additional categories or fields that you can use to customize the type of demographic data that you're sharing in the dashboard. So for example, the age breakdowns. We've tried to use the most standard, wide-ranging breakdowns of race and ethnicity, gender, and age that we could find, but inevitably, particular areas and agencies may want to modify these. And so our help documentation also, get that out of the way. Our help documentation also walks you through making use of these additional fields and modifying these categories so that you can best reflect the data that you want to share with your community. Just like Jeremiah showed you, this solution, the coronavirus vaccine distribution dashboard, is available inside of our ArcGIS Solutions app. And when I click Get Now, it's going to lay down the dashboard, the web map, the underlying feature layers, the CSV that I showed you, both the desktop and mobile version of the dashboard that you can then hydrate with your data and possibly embed in the hub site that you saw earlier. So while monitoring and sharing vaccine distribution data has some precedent in efforts like influenza vaccination, and some of dashboards like influenza vaccination distribution served as a model for what we tried to put together here, the challenges and complexity of that our public health agencies are facing are really wholly unique. So what the vaccine distribution dashboard does is allow organizations to quickly implement a responsive and useful dashboard that they can use to keep both internal stakeholders and the general public informed. And with that, I'm going to pause here and see if we have any questions that we can answer before handing it back over to Scott to wrap up.
Hey, Mike, while you're still sharing, can you just talk for a minute about how you guys designed the dashboard to be responsive or at least support 1 and 2 dose vaccines or partial and full coverage? Just talk, I mean, there's a lot of talk about the Johnson & Johnson one coming, right? That'll just be one shot. Will this dashboard still work for those?
Yeah, and it would be a pretty simple. It'd be a pretty simple configuration change, and it's really about the data that you're reporting and then how you want to show it in the dashboard. So we even heard of some vaccinations that might require, say, a 3rd dose. So what we wanted to do is be flexible to handle one or all. The most common pattern that we saw straight out of the gate, I think the ones that we're most familiar with are 1 and 2 dose. So what we did is indicate those coverage rates in a partial and full series. Rather than saying 1 and 2, we want to be flexible for the number of doses that might actually be required. But for a single dose, what we would do is, say an area just had a single dose. The easiest thing to do would be to remove the partial series coverage information and then populate the data on the full series coverage. So you're not locked into these categories. It's just that out of the way we wanted the configuration to be when you initially implement it is the most dominant pattern that we saw, and that's really a multi-series vaccination.
To date, yeah.
Yeah.
And then how about, I know one of the patterns we saw in the flu dashboards is you may want to track the actual, I don't know if it's supplier or the, is it the Pfizer one? Is it the Moderna? Is it the Johnson & Johnson? Could you do it by type as well?
You could, and the documentation kind of walks you through extending in the way that Jeremiah mentioned earlier.
Okay.
Because we're built on the ArcGIS platform, you can extend this further to include that kind of information. That is a common pattern that we see on influenza dashboards, as well as provider types. So not just the type of vaccine that people are getting, but where are they getting it? Are they getting it at a pharmacy? Are they getting it at the local health department? Those are categories that you may see us extend this dashboard in future releases, but can absolutely be extended to be included in this dashboard.
Okay. Other questions, Matt? Before we switch over?
Yeah, and then in terms of the dashboard itself, someone was asking, can we elaborate a little bit more about can we elaborate how we've created a dashboard that's mobile response, so that kind of you showed the mobile responsiveness.
Yep.
They mentioned in the past they were kind of creating two versions of the same dashboard, and is that the case here?
That is what we've done. So you can see here in the URL, this is what we're actually viewing as an experience, and this experience has 2 applications embedded in it. So I'll go ahead and load that mobile site. Where I showed you before, it was preloaded. Right now, the experience is recognizing that I want to view it on a mobile device, and it's loading the appropriate application. The nice thing about the solution is you get the mobile dashboard, you get the desktop dashboard, and you get the experience with all of that pre-configured and wired up. So you really, this is the URL, well, not this exact URL, but the one that would be deployed into your organization. That experience URL would be the one that you'd want to share itself and embed in a hub site if you wanted to do that as well. So that is the pattern that we're using. Although what we're able to do when we deploy it with the solution app is sort of wire all of that up for you, and all you really have to do is worry about populating the data.
And someone asked, it was actually a little bit earlier in the meetup, about I think this would be a nationwide data feed, so vaccination data for all states, kind of drilling down to the city or county level. And I don't, not sure if we have any information on that.
Go ahead, Mike, sorry.
Yeah, I was just going to say in terms of data providers, maybe someone else on our side might, but the primary use case that we're trying to support with these applications is the local health department or state health department that is really trying to monitor and share their authoritative data rather than source it from elsewhere. So could you elaborate on that at all, Scott?
Well, I was just going to say, looking for if that data is flowing, at least domestically here, up to the CDC, much of this data that we showed in the dashboard. So that's one place you could go look. I don't know if they're making that. They then have their dashboards that they're exposing metrics. I just don't know if they have the actual raw data feeds that you could tap into.
And then the other, I guess, along with what I was saying about a local or state health department trying to share their authoritative data, is this capability to display data by an aggregate area or to break it down by individual components, whether those be health regions, counties, or a county that wants to break it down by municipality or township, for example.
So the geography is really flexible, Mike, right?
That's right. Yeah. And I'm not sure if I mentioned this, but it can also just be deployed for a single location. It doesn't, the pattern that we're showing here, because we want to show that flexibility, is what we call an aggregate area. And then the geographies that make up that aggregate area, but that's not at all a requirement. It could just be configured and shared for one area. And again, our expanded help documentation that Jeremiah was highlighting explains all of that and how you configure the data. Really, it's data configuration that drives these different capabilities.
And another question came in. So the question is, did you consider a solution to capture the vaccination of each patient, and then from that data captured, make statistics and other information available?
So if I'm understanding the question, it's, did we consider what we saw in the vaccine distribution reporter is these are aggregate numbers. Did we consider sourcing it with each vaccination? We did, but because we thought this route was sort of the most flexible for the most number of users, because we're not trying to tie any direct integrations into a system, and it might be reported from disparate systems. So if I'm a county health department, I may be getting information from both private companies and my own clinics. The ability to summarize that information and report it that way seemed to make the most sense. And also sort of a more technical reason, the numbers that we're talking about at a state level of individual vaccinations could be unwieldy for a dashboard to show.
The other aspect of that, Mike, is just the PII associated with that. And so there are patient management systems that exist out there, and we really wanted to just let them leverage that information, and we just wanted to leverage that information, not duplicate it.
Yep.
Okay. Well, maybe, Mike, I'll just take the screen back and just wrap up with a few slides and go from there. So thanks for all the great questions, everyone. Hopefully you can see my screen again. I just wanted to summarize with what you saw today. So we showed you two ArcGIS solutions that were released right before Christmas, coronavirus vaccine outreach and the vaccine distribution dashboard. And they require an ArcGIS Online subscription and ArcGIS Hub Basic, which obviously comes with ArcGIS Online. So there's very little software required to get started with these solutions. As I mentioned early on in the presentation, all of these solutions are fully supported. So if you do have questions or just struggle with any aspect of the solution as you're deploying it in your organization, you can contact Esri Support Services, or you could reach out to your account representative and perhaps look, for additional implementation and enablement support. Maybe you don't have the capacity or time now, or you need some help with some of the aspects of ArcGIS that we showed today, and you just want additional support. There are options there available for you too to really kind of advance that if you'd like. So just know that don't struggle, right? There's help out there, and certainly, we're certainly willing to answer any questions you have as well. As Mike mentioned, I think a few minutes ago, right? I mean, we started this work really when the availability of those vaccines were just being announced. and state plans and the CDC guidelines had been developed. And we know that's evolving and that's changing. And so we're continuously looking at the feedback we're getting from organizations that are implementing the solution, feedback like you gave us today. And there may be versions 2 or 3 of these solutions heading in later into Q1. I'm not saying there will be, but we certainly want any feedback you have because that helps us evolve the solution. And we'll be continuously monitoring kind of what guidelines come down from the CDC and how the states then and locals, at least domestically here, execute those plans. The other thing I'll mention is that there was actually a third solution we had started working on and have started working on that really was more valuable later on in the implementation of the vaccines, when you're starting to get beyond these initial phases and you have more widespread availability of the vaccine, and you need to start looking for and evaluating provider coverage and where you might have gaps in what we call vaccine coverage. So know that we are actively gathering requirements on a potential third solution to help communities ensure that when more widespread availability of the vaccine is available, that you are reaching all the necessary populations in your community. And if you are interested in kind of working on that problem with us, please do reach out, because we'd like to engage with customers who are starting to think about that problem. We understand that may be coming in future weeks, but just know that it's something we are looking at. And it certainly will be probably a more analytical workflow than what you saw from Mike and Jared today, to help you kind of analyze existing information, coverage areas, and then determine where you might want to site new providers or at least bring the vaccine to the community. And I guess I'll just kind of close today by saying, the vaccine solutions we showed you are really part of a large portfolio of work that we developed in 2020 to help you respond to the pandemic, maintain business continuity, as we all kind of became remote workers instantly, evaluate your testing capacity. The other thing I want to highlight is that there were a set of solutions we developed in late spring of 2020 to start to help with recovery aspects in your community, small business recovery, reopenings, wellness checks, and even things like health screenings and site safety as you begin to open facilities again in many parts of the country and the globe. And while that second wave hit us here domestically much faster than we thought, and really precluded many organizations from tackling some of those challenges, hopefully as the vaccine becomes more broadly available, the timeliness of those solutions will appear again. And I just wanted everyone to just understand that there are a vast number of resources available to you to help you with recovery efforts in your communities as well. So with that, we'll just close by saying, everything we showed you today is available on the solution site. Both Jeremiah and Mike mentioned, that is the destination to go look at the solutions in more detail, deploy them, and start to work through those configuration patterns. There are a whole host of other COVID-19 resources available at our GIS hub, content, additional technology that Esri's developed beyond the solutions, and even best practices and assistance there. So please do make sure you're aware of those resources that are available to you as an ArcGIS user. And with that, thanks a lot for your time today. Please do take a few minutes, if you don't mind, jotting down. I think Matt will probably share this URL in the chat, but do take some time to give us some feedback on this meetup, what you liked, didn't like. If there's additional information you may need, we use that feedback to guide future meetup topics and how we deliver this content to you. And we really do appreciate it. We know your time is valuable. We appreciate you spending an hour with us today to understand the vaccine distribution solutions in more depth. And we can certainly take any final questions you have. Thanks a lot.
And there is just one question about sending out all of the links that I was sharing in chat. And I know it's kind of hard to maybe open all those up while we're demoing to you. So I will go ahead and on our meetup site. So for you signed up for this through our meetup site. Through that, I will send an bulk email to everyone that's part of that with all of the links that I shared today, because there was quite a few of them, just so you have all those resources, all the documentation links, the surveys, the sites that Scott just mentioned. So I will be sharing all of that with everyone on the call today.
Great. Any other final questions, Matt, that came in?
I don't see any other questions.
Okay. Well, thanks everyone again for the time and taking an hour with us.
Thanks, everyone.